Hello, and welcome to the Stem Cell Healing Institute podcast. In case you have any questions regarding this program, please write us at info@stemcellhealinginstitute.com. Thank you and enjoy the podcast. Hello and welcome back to Stem Cell Healing Institute podcast. I am here with Dr. Sara Figueredo and we have a very interesting topic today, which is stem cells for diabetic patients. Hello, doctor. How are you?
Very good, Luis. Thank you so much for having me. It's always a pleasure being here.
So I believe stem cells can help with the pancreas, in this case for diabetic patients. Is that correct, doctor?
Absolutely, Luis. You hit the nail on the head. So basically, what our goal is with diabetes is we are trying to stimulate regeneration of the delta cells of the islets of Langerhans cells in the pancreas. And those are the cells that produce insulin in response to glucose in the blood. So in what happens in diabetes, especially in diabetes type 1, is that the pancreas is not producing the insulin in response to the glucose. And that's because there's an antibody response, an autoimmune response of antibodies that are attacking these cells. So this is called an autoimmune disease or autoimmune condition. So the goal of the stem cells is to do two things. Is number one, to shut off the autoimmunity. Okay, so to modulate the antibodies that are attacking the pancreas, number one, and number two, any damage that's been done to the pancreas, to the delta cells of the islets of Langerhans, we want to regenerate those cells so that they can start producing insulin again in response to glucose. So that is what we are accomplishing with the stem cell treatment.
And I should ask you if this treatment works for type 1 and type 2 diabetes?
Very good question. Yes, because both types of diabetes, they work a little bit differently. So type 1 is an autoimmune condition where your body is attacking itself. Type 2 is something that can really be easily controlled by, or at least in most cases, it can be very easily controlled by lifestyle, okay, and the environment, and a diet and exercise and reducing weight and not even weight per se, reducing fat. What we found is that obesity, and this is not weight, this is more about the fat cells. They prevent, for whatever reason, they prevent the peripheral glucose levels so the glucose levels in the rest of the body. The insulin is there, but for whatever reason, the cells are not taking up the insulin and the glucose. Okay, so they're not, the insulin is just not being recognized in the cells, in the peripheral cells of the body. So the insulin is there, the pancreas is working just fine, but the insulin is not having an effect in allowing the glucose to enter the cells. So, and we found that in obese people, this is what's happening. And once they reduce the amount of fat in their body, the fat that they accumulate, on their arms and legs and bellies, once it's reduced, the insulin response gets better. So it's a very interesting way, and actually a very interesting cure to type 2 diabetes. But the stem cells help with that also for type 2, but especially for the autoimmune type of diabetes, which is the diabetes type 1.
I need to ask you, what type of stem cells do we use for these type of patients?
Yes, that again, Louise, that's a very good question, because what we like to do is with autoimmune conditions like diabetes, multiple sclerosis, rheumatoid arthritis, lupus, all of those types of autoimmune conditions, we like to use endometrial stem cells, which come from a healthy female uterus. And we combine those with the bone marrow stem cells of the patient's own bone marrow stem cells. And we can also opt to use one or the other. We have patients that don't want to have allogenic stem cells, which means coming from someone else. They just want autologous which means that they're coming from the patient's own body, and it's just fine. It works. It works just as well. However, we do find that endometrial stem cells work very specifically well for autoimmune conditions without any negative side effects or rejection or anything like that. So it's a win-win situation.
And when can a patient with that does the treatment with us start feeling better after the first deployment of stem cells?
We have patients literally within weeks have their insulin needs going down, and it's quite remarkable how quickly the body can respond. And so we've seen it within weeks or months where literally there's one patient I'm thinking of. It's actually a UFC fighter, MMA that we treated, Jordan Williams. He's happy to use his name openly. Within 5 weeks, he had his insulin needs going down about a third, and he's on his way down. And we're looking to do another treatment for him also. So and this is just a couple of months down the road. So we're going to wait and see the response still, because the stem cells work for they can work up to a few years. So we want to see the effect that the first treatment has had, and so that we don't have to do another treatment.
I see. And do you recommend that patients with diabetes come and do the treatments in a periodic time, or is just one visit will be enough?
Oh, the goal is one visit. We
Okay.
have patients that where their needs are reduced or completely eliminated after one visit. And the reason for that is we try to adjunct the therapies with so many other modalities like oxygen therapy, nutritional detoxification, mineral and herbal therapies, as well as diet and lifestyle and psychological counseling, which really helps in every aspect of a patient's well-being. And when we address all of these factors at once, and then we have a high number of viable, healthy living stem cells, one treatment is most often than not enough. So it's very, very adequate amount of stem cells in treatment for one treatment to be sufficient.
And one thing that I have to ask, because diabetics, the whole issue is about the diet. I mean, whoever suffers from diabetes, the whole problem is, oh, they are unable to eat some things that they love. In this case, would they be able to give themselves some treats, or I have to ask
Yes,
you because.
no, I like that because this is very real life. That's a real life question, because you're right. It's a practical question, and absolutely, life is too short. I don't believe in complete restriction unless it's life-threatening condition, right? But absolutely, once the blood sugar is controlled and the insulin is responding, the pancreas is responding well and producing insulin, absolutely, a patient can have some treats. They can, and again, in moderation, everything in moderation, even in healthy people, right? And they can have their treats without having any harmful effects. And absolutely, it's all about quality of life, right, Louise? It's about improving a patient's quality of life, and for some patients, eating the foods that they love. Other patients, the ones that are in pain, it's about playing golf again, or being able to run again, or play tennis again, or if it's a matter of pain. So this is all about improving the quality of life. So
And we
absolutely.
always talk about patients with high blood sugar, but diabetic suffers from low blood sugar as well. So that will
Yeah.
be addressed, and that it will help for patients that have low blood sugar. Is that correct?
Yeah, what usually happens, and that's true. There's a fluctuation of blood sugar, and usually what happens in that case when there's a low blood sugar issue in diabetes, it's because their insulin, for instance, it's usually in patients that are type 1, where they've taken an insulin shot. and they haven't eaten. Okay, so and so what's happening is any blood sugar that there is floating around, it's being taken up. It's been taken up by the cells, by the insulin that's just been injected, and then the blood sugar gets low in the patient's body, which again can be life threatening, just like high blood pressure can be. So yes, that's usually what happens in a diabetic when the insulin shot has been taken without any food to respond to the insulin.
So, if a patient comes to Guatemala, this is in the case they come from elsewhere, how long do they have to stay in Guatemala for treatment, and what accommodations do we provide, doctor?
Very good question, Louise. So yes, so we would have them stay for about 7 days, 7 to 10 days, depending on what we need to do in terms of treatment. And we do provide full, very comfortable accommodations, an Airbnb style apartment, and we also provide a driver or a chauffeur to take them to and from appointments and so on and so forth. So we make all the necessary arrangements for that, and also for any travel, airplane flights and things like that. We can help with that as well. But we do provide in the treatment package the accommodations as well as a driver. So it makes it very comfortable for the patient and to easily travel to Guatemala. And, Guatemala being a destination spot in terms of tourism, there's so much to do and see here with the active volcanoes and the coffee farms and the ruins. It's a beautiful place to have a medical treatment, to kill two birds with one stone.
Excellent, doctor. So, if a patient would like to contact you, how can they do that?
Yes, they can reach us by email at info@stemcellhealinginstitute.com, or they can reach us by phone at 209-690-7836. That's 209-690-7836. That's our US number. We also have a WhatsApp number +502-4220-7297. That's +502-4220-7297. And they can also um, contact us through Facebook and Instagram, and as well as YouTube. We have our YouTube channel with videos and podcasts.
That is correct. So, doctor, is there anything else you would like to add to this podcast?
No, I think that is it. I think we covered a lot of ground, Louise, in the short amount of time.
All right. So, for you out there listening, if you know someone that suffers from diabetes, the stem cells can help. So, please contact us and listen to this podcast because we put out one podcast per week. Thank you for listening and see you next week.
Thank you so much, Louise. You have a great weekend.
You too, doctor. Bye bye.